Welcome to HERcast with Dr. Chito. Today we have a very insightful conversation titled Beyond Band-Aids, Preventing Childhood Injuries and Abuse. We're going to delve into crucial topics of child safety, identifying abuse, and the importance of wellness visits with Dr. Anthonia Shagaya, a seasoned pediatrician. Dr. Shagaya completed her pediatrics residency training at Long Island Jewish Hospital Health Systems in New York. She then volunteered with Family Health International, FHI 360 in Nigeria, assisting in the development of pediatric HIV mentorship program. Returning to New York in 2012, Dr. Shagaya pursued subspecialty training in pediatric infectious disease. In 2016, like most of us here, she returned to Nigeria, joining Nisa Premier Hospital as a pediatric consultant, where she also co-founded and led the Sickle Cell Disease Clinic. Dr. Shagaya's commitment to SCD led her to establish the Sickle Cell Well Africa Foundation, that's her baby, dedicated to promoting the health and well-being of those living with SCD. From 2018 to 2023, she served as the Chief Medical Officer and Vice President of Clinical Affairs for EHA clinics, where she spearheaded significant initiatives such as developing the first private COVID testing site and isolation center in Abuja that we all know of, and expanding EHA clinic network in Abuja and Lagos. So you know that this is going to be a conversation that no parent, no caregiver, no teacher, anybody that deals with kids should not miss. You will gain invaluable insight into safeguarding your child's health and well-being from Dr. Shagaya's wealth of experience and expertise. So Dr. Shagaya, welcome. It's such an honor to have you on HERcast with Dr. Chito. She's also a good friend, so it's going to be a great conversation.
Thank you, Dr. Chito. It's a pleasure. I was telling you this is my first podcast, so I'm very excited.
So great.
And happy to be here.
Awesome. So we're just because we have this half hour, but it's going to be a 1 hour. So this is the first part of our conversation, and we'll continue it. And then we'll continue next week on the second part of the conversation. So to start, can you discuss the importance? And I'm going to start with this because this is something that in this climate, people are not really accustomed to. Can you discuss the importance of regular wellness visits for children, particularly in terms of monitoring their development and identifying any signs of abuse or neglect? Because most people here think it's just get your vaccination.
Exactly.
So it's something that we could start with.
Thank you for asking this question, because this is a topic I'm very excited about. So, as you said, in our climb, we like to go to the hospital when there's something wrong.
Yes.
But the well child visit is one that enables, the parents, the pediatricians, be able to discover things, early on when they can be dealt with and dealt with successfully. Because there's certain things, if you pick up later on in life, or late as the child has grown, that you can't really, go back and sort of fix.
Yes.
So the well child visits, they deal with more than immunizations, but immunizations are a very important part of the well child visit. So we look at the development, the growth, nutrition. We talk about school in the older children, like teenagers, right? We talk about, how they're doing in school.
Yes.
I like to say, sex, drugs, and rock and roll.
Yes.
But those are all important topics too that you talk to with the teenagers as well. So it encompasses, so many things. You also talk about safety, what we call anticipatory guidance, where you sort of let the parents know what's coming next. And also, things to look out for and safety with the child as the child develops through the different stages. And you were talking about how does that pertain to like abuse and
yes.
There's certain things you see in abuse, certain patterns. So for example, in developmental milestones, right? A 2-month-old child, there's certain things they're supposed to be doing 4 months. In abuse or neglect, you see that children either do not meet their milestones or regress. So that's one of the things that happens that you can pick up, during the well child visits. So those are things that are important. And then during the well child visit, that's when, you're able to guide the parents. That's certain developmental stages.
Yes.
There's certain injuries that are more common. So, you guide the parents through the developmental stages, what to do at the next step, how to safeguard your child. And so those are important conversations that, go on during the well child check. Usually it's like, the first check is,
Yes.
after they leave you,
Yes.
the baby is born, they come to me.
Yes.
2 to 3 days after delivery, we like to see the children, the
Yes.
babies. And then, really you should be having your well child check regularly. So at 1 month, after that, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 2 years. And then some people do 2.5, but you can do every year after 2 years.
Yes.
Right, yearly visit.
I think I don't joke with that. I will not lie. I know many people here will say the best gift they can give their children education. I say it's health. As I said, good health, because a child that's not healthy can't even be educated.
Exactly.
So I think it's something that they need to really hear. Like, I remember my son, there's an age you allow them to start having their own bath, right?
Yes.
So, I mean, for a period, he's having his shower. I'm trying to give him privacy. And then I remember going to pediatrician's office and he was like, oh, the hairs have started. I said, from where? And you see, and then she was able to advise what to expect and all that.
Yes.
Imagine that I wasn't going anywhere for wellness. I will have a child developing in ways I'm not sure what to check for, what to look out for. And then when there's a problem, you now start coming. It's better to prevent the problem with kids.
Exactly.
Honestly.
There, I remember this was a family friend story, and she went to her pediatrician for just a well child visit. And, in the examination of the child, she noticed, actually the parent noticed it. She was like, oh, there's something doesn't feel, she was bathing the child. And from there, brought them to the pediatrician for the regular, well child visit, and the child was diagnosed with a tumor.
You see?
And it was just from an exam. And otherwise the child was fine, doing well. But, it was able to be picked up quite early, managed, and, the child is cancer-free this day, right? So those are just important things. Speech, is one that you can intervene. Development.
But most times parents are in denial.
Exactly. So, and sometimes they don't know when is the time for them to do certain things. And it's important as, pediatricians for us to let them know, this is actually not normal. And then we can guide them through how to take care of, the situation and, provide that support.
So that's very, very important. So are there specific age or development stages where children may be more vulnerable to certain types of injuries or abuse as well?
Okay. So actually, let's go back a little. So let's talk a little bit about abuse and what abuse is, right? So there are 3 sort of major categories of abuse. So there's physical abuse, right? Any bodily injury done to a child, beating, kicking, punch, and then also burns, throwing of hot water, people, cigarette burns, and so all sorts of things. So that's physical, abuse. Then there's sexual abuse. Sexual abuse is, any sexual intercourse. So it can be and consent, right? In Nigeria, the legal age for consent is 18 years. Yes. So if you have sex with anybody below 18 years, it's actually abuse. I know it's not in all states, like this doesn't go, but then that's a whole nother topic.
Yes.
But 18 is the official, age. So anything, below 18 is without consent. Exactly, is without consent, and children cannot give consent below that age. And then, above 18, sexual abuse is if, you say no, you have to give consent.
Yes.
And another good point is also you can give consent and take it back.
People don't know that.
Exactly.
Yeah, people don't know
that. So people are like, no. You said yes in the beginning, but and as things are happening, you can say no.
No. Yes.
And that's still sexual assault. And then there's neglect. So neglect is you're not providing food, shelter, clothing, medical care. Verbal abuse goes into that as well. So those are all aspects of abuse. So we're going back to developmental stages that kids are vulnerable. So kids are vulnerable, below the age of 1 when they're nonverbal, right? They can't tell the parents like what's going on, and so at that stage, kids are more vulnerable.
Yes.
So below the age of 1, and then also with sexual abuse, below the age of 3 as well. So usually kids when they're 3, they start to be able to tell the parents, what's going on, and then usually, the median age usually is 9, especially for sexual abuse. But at any age, at any stage, abuse can happen. So for that's for abuse, but for injuries, right? So during the well child check, I'm just going to go through a few.
Yes.
Go and get your well child check
And
so,
get the whole package.
exactly.
Yes.
So at like 4 months, children start the things that happen developmentally at different stages. So at 4 months, children start mouthing, so they put things in their mouth.
Yes.
Right. And then at 6 months, it's like in overdrive, like everything goes into the mouth. Goes into the mouth. So that's when children pick things up, choking things that are left around, they put it into their mouth,
yes,
or poisonous. And then around the ages of 4 to 4 months, they start rolling. The first 3 months are bliss. You can leave them and then walk away and then come back. But after that time, they start, from 4 months, some children start, rolling over. So a lot of falls happen, at that point in time as well. And then
you just go to the bathroom and boom, your child's
exactly,
on the floor.
the child is on the floor. And then also walking, when the child starts crawling and creeping, right? And those are times when part of the anticipatory guidance is like you need to start child-proofing your environment, because the children then they're vulnerable to abuse, right? I mean, sorry, vulnerable to injury at that point in time. When they go to school, they start school, they're in that environment, they're playing. When they go to pools, right? That's a big one too, where we don't really think about, because not everybody has a pool, but people go swimming. Children are being taken away, taken to different
pools,
houses, people's houses, and we have heard about the accidents that have happened with kids as well. So those are some of the times that children are vulnerable. And then
teenagers,
when they're experimenting, with sex, drugs.
Puberty, very vulnerable.
Exactly. So that is also a vulnerable time. And the hormones, right? There's changes going on, pairs, and all these things. So those are times that they're also more vulnerable. So those are some of the stages, I would say, when it comes to like injury and abuse. Yeah.
I think that sometimes, like, my daughter still puts things in her mouth. That, like, at 7, that's too much, right? See, I'm trying to get 3 cons out here.
Well, she's past that stage. That mouthing, actually.
Everything is like, why is everything going to your mouth?
That mouthing is actually normal. Yes. And some parents try to stop the kids, but that's the way they experience the environment.
Yes.
That's the way they're learning the environment. And that's fine. It's just that you have to make sure that, it's not anything harmful or it's clean and, all that stuff. But they're like little detectives. They'll find things that are you yourself will not remember. See. Exactly. So it's important to like, child-proof the house.
And how about kids that suck their thumb? I think my niece sucks her thumb, and that's very nerve-wracking because their hands are everywhere.
Yeah.
So what do you advise parents when they have kids that, their thumb sucker, that suck their thumbs and...
Well,
their hands are like in so much and back in their mouth.
They are. There's certain things that you cannot stop and prevent. And I tell parents, once your environment you can control, once you let them go to school and daycare, they don't say, oh, this place is dirty, I've touched my hand, and not everybody also pays attention to your kid as you would.
Yes.
So there are things that you can prevent, right? I mean, kids use sucking as a way to comfort themselves, soothe themselves. So it's not like stopping them. Of course, at a certain age, we try and correct that. But it's making sure their hands are clean. Teaching them along the way and trying to ensure that their hands are clean. But there's not a lot you can do with having them, because they'll go touch something, play, and then. There's germs on their hands.
At that stage. Yes. Now let's break it down for parents, because I know some of the times when we talk about, in fact, there's very few houses I've been to, I've seen child-proofing with children, and I'm always having this, they're going to the socket, they're going here, I think maybe we really don't understand the concept of how do I make my home safe for children at different ages. What could I do to ensure my children are secure? And they don't have to hurt themselves, because sometimes you go to a house and you see scissors on the table and you see a 2-year-old, and it's so easy to be distracted by not notice that that danger is there. But sometimes you're like, no, all sharp should be all and things like that. What do you advise? Because they don't, in well visits, I know in the States they always tell you this and what you need. They always talk about child safety are different. So how can you communicate that with our parents out there here?
So development, right? That's another thing. So like what is safe for a 3-month-old is not safe for an 8-month-old.
Yes.
So usually this, kids will start creeping, moving around. Like, some kids are actually, it's a range. Some kids start things earlier, some kids later. But like at that 8-month period, you want your house to be childproof. And what you need to do is actually get to the level of your child. Go down, not like literally go to the level of where you think your child, and look at all the areas that you think that you can find that they can get themselves into. So things that we advise is like, when you have cabinets with anything kids love, every day take pulling down things, things that are heavy that they can reach, make sure those are out of their reach.
Yes.
For cabinets, if you don't have these are child proof locks that you can put on cabinets.
Yes.
But if you don't have the child proof locks, what you can do is anything liquids, right? Those are poison. Kids have ingested, and don't think, it's not sweet. They will drink whatever they find.
Yes.
It looks like something I like. It's green, right? Antifreeze or anything they will ingest. So you have to look at the level of the child in any of the cabinets below, and then put it, out of their reach. Yes. Sharps, kitchen safety is also really important. Many kids, they go
in there,
and then
I just ban them from the kitchen. Period.
Exactly. And then there's sockets. They're also socket protectors, right? Yes. Where you can put because I know, I think kids are bent on trying to kill them. Kill themselves at a certain age. So everything dangerous, they'll find themselves there. Yes. So all these sockets,
they'll take a pen and put in a hole in the socket.
Exactly. And then, just everything. And then for parents that have stairs, right, there are also those gates that you can put where the stairs are, and to ensure that the child can't come off. And then also when you're leaving children too, and the younger children that start rolling off the beds, you lower their cots and cribs at a certain age, and to make sure that the environment is safe. But those are the basic things that we can do. Just you have to like be a detective. Yes. Go down, literally down to where the eye level would be, and look around the house for potential things. Everything is a potential weapon for the child, or a thing to use to harm themselves. Sharps and things like that. And then also little things that they can choke on. Right, we forget that candy, hard sweets. Kids shouldn't have that, because
people giving kids even peanuts.
Exactly. So those little things, like the developmental stages that they can chew, but the food should really be cut really tiny so that it won't be a choking hazard. You send them to school, they don't always cut up their food like the way you need to.
So do it at home.
Do it at home.
Cut the food right.
Exactly. Yes. And sending them, at certain stages, there's certain foods that they can have, right? So it's not at every stage. Of course, the older kids can have hard candy, but like a younger kid, they put it in their mouth. Yes, they're sucking and enjoying it, but before you know it, they've swallowed it
and they're now choking.
Exactly. So hard, and then these little balls, we have these camphor balls around the house too. Those are things that you need to get rid of.
I believe that with kids, you just get rid of. Don't
exactly. Just get rid of it.
It's better to get the cockroach than to get their child choking or eating poison.
And they will, and you say, "Oh no, it tastes horrible." They won't put it. They will put it in their mouth, and
before they know that it tastes horrible, they'll put it in their mouth. Yes. And I'm now thinking of kids, but keeping your kids secure in the house older is now becoming harder, right? Because when we talk about secure, it's kind of about, not following the wrong people or, all those kind of guidances, but now it's on the internet. So I don't know, right now, have they changed that focus where now we also have to look at what these kids do? Because I see 7-year-olds on iPads and stuff watching YouTube, and I know things do drop in there. And then playing what's this game? There's a game, Roblox.
Yes.
Where they can play with other people that they don't know. And so, there's a tech part of it now and trying to keep these kids secure.
Yeah, absolutely.
How have you guys incorporated this in pediatrics when they come in for visits and stuff?
So there's child, safety, like, it's child safety apps that you can have, that you block them from certain sites so that they can't get to those sites, right? For the younger kids. But then, you have your older kids, teenagers and stuff too. But I think this is where having conversations are important. Sometimes it's not even your device. Sometimes it's like, they go out somewhere and then they see something on somebody else's device. Abuse is actually exposing children to pornographic content.
Yes.
Under the age. Yes. So that is also abuse. If somebody shows your child that kind of content, it's abuse. and so they shouldn't be showing your child that. Right? You can control it, but again, the children go out, but it's important to put those safety measures when it comes to things they see on the internet, and those apps, and that YouTube. They will find anything. Sometimes it's amazing, like how young they can go and like search for things and find things on YouTube when you do not have those safety measures. There are certain safety measures you can put that won't allow them to be able to search. YouTube is only the things that you download on there, and it's important to also be engaged. Look at what they're doing, see where they're visited, and it's a constant supervision. So it's not
it's
just
a crazy supervision, and they're smarter than us.
Exactly, and so it's not even in just the physical. Now it's online. Everything is online, and there's so much danger. I know in Nigeria, it can happen here where people can lure your kids, especially teenagers, as well. They pose as somebody else. Exactly, come meet me here, come do this, and so again, it's important to be able to monitor. Now, everybody has a phone. Young kids have phones, so it's easier for them to sort of everything is in their palm.
Yes, like my sister does the track GPS, and if you dare put anything off, you're gonna lose your privilege of going anywhere, because she tracks where their phone is at all times.
Exactly.
So there are ways. I mean, nothing is 100% foolproof. I think as a parent, you go crazy if you think you can 100% foolproof. But it's to make sure they have the knowledge to try.
Exactly, and it's having those conversations. And I think we don't have a lot of conversations. I think we're getting better now.
Yes.
Going back to when we were growing up, there are many conversations that we should have had.
Yes,
but we haven't had. And the conversations that some of our, us as parents have had in the past.
Yes.
Now some of the things are irrelevant. So now they're actually new conversations that you have to add to the old conversations that you have to have with kids.
Yes.
Right. So it's ever evolving. And that opening that line of communication and talking about things. I think a good way too is like when they're, especially kids are on social media. So sometimes you see an event happen on social media, and that is a segue for you to have that discussion with your teenagers, about a certain thing. Also, this happened, what do you think about it? Right? And so what are your thoughts on it? And let's have that conversation. And you can open the door to actually having the conversation.
I think that's very important. I think that having the ability for your kids to talk to you now is important. Then our parents didn't really care what we had to say. This is the rule. This is the law. Take it or leave it. You follow it. There's no conversation. But now we have no choice. We're dealing with invisible things that we can't see. We can't, it's not like with the bad friend you had, don't talk to that friend. Now we're dealing with really invisible things, so we have to. Now, there's one thing here in our climb, having nannies and other caregivers, and even sending your child to school, all this, and sometimes even parents, to be honest.
Yeah.
How do you differentiate between accidental injuries and those that may be actually indicative of abuse? Because sometimes, she put her hand in the door, but someone slammed her hand in the door. But what are the other ways? What ways can you differentiate between accidents and abuse?
Yeah. So there's certain injuries that honestly you can't differentiate, but there are certain things that you can. So for a child that's non-mobile and has things like fractures, that's not explainable, right? A kid that's not running around to be able to do anything, that's a red flag right there. When they have injuries, fractures, you see bruises that you can't explain. Another thing is when the story doesn't match the injury. So that's a red flag, an automatic red flag. And you should be asking those questions like, this happens, what happened, right? And you should be thinking, okay, is this possible? Is this, because again, sometimes the stories will not match what the injury looks like. So that's a red flag. Other things that, there are certain fractures, right? Skull fractures. Yes, children can fall, but again, like in the younger children, when they're not really mobile to be able to do that, right? Long bone fractures, you see rib fractures, especially posterior rib fractures. When children get x-rays and
so that means they were kicked or something.
Exactly. Okay. And there's certain, they have multiple, injuries that you can see on x-ray with different dates of healing. So one looks like it was a year old, right? You happen to get an x-ray and you're like, this person had a fracture. This is, just these multiple injuries that happen.
Yes.
A lot of when you grab a child, bruising sometimes, especially when you're lighter skin, darker, you might not see it, but that bruising, broken fingers, right? Again, that it can be, yes, it can be okay.
Injury.
I slammed
The door.
door, but then it can be again cigarette burns. There's
Never.
it's never an excuse. Like the child should never have a cigarette burn. And then talking about stories that don't match, like a child that has burns from the back, you ask the caregiver or the parent, how did this happen? And they say, oh, no, they pulled it from the stove.
Why is it in the back?
Exactly, why are you having the burns in the back? So these are some of the things that you see. For sexual abuse, right? Like younger children bleeding, vaginal, penile pain, and sometimes even discharge, right? But not every discharge, in a young girl is, any STD.
Yes.
Any
Yes.
STD, it's abuse. There's
Yes.
no explanation, especially younger,
Yes.
right? We set 18 down.
Yes.
When you can't consent is sexual assault. So you have to go down that route, investigating it at that point in time because it is sexual assault. So
Although it's
some of
harder
the
when it's
things-
of teenagers of like teens of the same age.
Pardon?
When you have like a 16-year-old and a 16-year-old, it gets
Yes,
a little bit
exactly. Those things get a little because they're
Both
both they
underage.
can consent, but they're indulging in that behavior. So
Yes.
we have seen that
Yes,
as
I'm
well,
saying,
and it's
yes.
really sort of like tricky, and it's hard
Yes.
to sort of sort that out.
Yeah, I think when it comes to abuse, I think from the gynae perspective, when they come, we look at the hymen for girls.
Yes.
I mean, it's harder for boys sometimes because you might not have anything that was disrupted
Yes.
for boys. So you have to really be on point. But for girls, we look, and that's why I always tell mothers about, when you talk about the well visit, because you are able to examine, and you guys, pediatricians also look at
Yeah.
the genital area and see, okay, everything is formed well, so that the difference is noted. So that if
Exactly.
I'm trying to think of, did anything penetrate, I will
Did
look at how
anything-
I know how it was before, because hymens they vary in ways they're formed. I'm like, no, this has changed. This has been penetrated.
Yeah.
So I think that's also very important to know
Yeah.
that for sexual abuse and penetration, we're able to
Exactly.
by an
And-
exam. So you always have to reach out to the doctor
Yeah.
for cases of suspected abuse.
Exactly. And then there are also behavioral things, right, that you
Yes.
can pick up on.
Yes.
So it's not just the physical. Sometimes there might be no, as you said, young boys, you
Yes.
might not know if there's anything happening,
Yes.
right? So, but like, change in behavior, right? They all of a sudden they're more clingy. They're just afraid. They're having nightmares. They're waking up and having nightmares and not being able to sleep through the night.
Yes.
Developmental, right?
Yes.
Some have been toilet trained. All of a sudden now they've regressed.
Yes.
That's one. Or they were able to obtain nighttime dryness, and then they start bedwetting again.
Yes.
Aggressive behavior. A child that was otherwise nice, lucky,
Yes.
becomes really aggressive, or actually, young children start acting out some sexual things that it shouldn't. So
Yes.
those are things too that you can see. They get depressed, their grades fall,
Yes.
they're more withdrawn, they don't eat, so the rapid weight loss
Loss.
is another one, or weight gain, right? Because again, food can be that thing that
Soothing,
that they,
soothing,
exactly.
yeah.
So there's certain behavioral things too that you can look at. So it's important, and in development, if they sort of go back and regress in their development, that's something that needs to be. I mean, again, it's not absolute, right? Because there are things that can be illnesses that can cause those things, but again, it should always be on our radar. Like exactly.
Like what's-
There's this. In medicine, we do this differential
Yes, and our diagnosis,
Exactly.
you have to always be on that list that
On
this
lots
could
of
be
things, exactly
what
the
you don't want to
possibilities.
miss.
Exactly.
Yes.
Exactly.
Thank you for tuning in to today's episode of HERcast. While we've covered significant ground in our conversation with Dr. Shagaya, we've only scratched the surface. So join us next week as we delve into even deeper into this crucial topic of child safety, identifying abuse, and the importance of wellness visits. Don't miss out on the continuation of this insightful discussion. It's a continuation. And so we're going to be here like this, discussing again next week as we finish the final hour. HERcast with Dr. Chito is more than just a podcast. It's a movement, empowering, educating, and elevating her life. Join a community dedicated to living their best lives, guided by experts and thought leaders. Don't miss upcoming episodes on Rapid TV channel 176 on Star Times. Listen now on your favorite podcast platform and watch full episodes on YouTube. Follow us, ask your questions on our IG page at HERcast Podcast and at Dr. Chito.